Professor Dr. Vivek Gupta, Cardiology, Delhi Apollo Hospital. Today in London Valve Conference, PCR, part of the PCR conference, and this is actually dedicated conference for the valvular technology, structural heart disease. I have also to tell you that I worked with Alan Crebier, the time when actually the things were evolving, and I have the privilege to be standing and meeting Professor Dr. Patrick Serruys, who is a name of cardiology from Rotterdam, Holland earlier, in Netherlands, and I wanted he and along with many others like Jean Fajate, Marco, Martin Leon, Greg Stone, the people from Switzerland, Antonio Colombo, they actually made a real change how you can do a non-surgical treatment of coronary angioplasties. And now he's also involved with the structural heart because Alan Crebier did the first in man TAVI, transcatheter aortic valve implantation in 2002, and after that structural heart, especially aortic, then mitral, then tricuspid, they all have become very common to avoid surgery in high risk patients, also in low risk patients. So Dr. Serruys, I wanted to just in next 2 minutes want to know what has been your real contribution, and you have contributed a lot in the evolution into interventional cardiology as such, starting from Rotterdam course when you started doing in Rotterdam and then merged with PCR.
Okay, that's very simple. I started at the Thorax Center in 1976. The first things I developed with Hans Schreiber is the quantitative angiography, which is still there today. The QFR is just a version of the QCA. Then came the balloon angioplasty. We started in 1980. I had the privilege in 1985 to have the first New England on balloon angioplasty in refractory angina pectoris. That was my first New England. And then the next step was, that's 85, let's say 87 and 88 with Alain Crebier. He came to Rotterdam to do valvuloplasty. We studied that intensively, come to the conclusion that there was restenosis. Then there was a great era of device, laser, atherectomy, rotablator. I was part of all these major trials. And then after 12 failure of pharma treatment, I tried everything. It's all published in Lancet, New England Circulation.
The recent trial?
I went to the device, so I started to work with the wall stent that I criticized very much in 91 in the New